Have you ever felt that your body might be sending urgent signals before a serious illness fully takes hold? It can be surprising to learn that these signals sometimes arrive in the form of unexpected smells that most people ignore. Recent research has highlighted how various cancers can alter our natural odors, serving as subtle early indicators of disease. You might not associate a change in breath or skin scent with a life-threatening condition, yet the scientific evidence is growing. Experts are uncovering how certain metabolic processes in cancer cells release unusual compounds that manifest as distinctive smells. Staying vigilant about these changes could be the difference between timely detection and missing the chance for early intervention. Today, let's get into how these hidden odor signals may be your first line of defense against undiagnosed cancer. After all, the human body is a fascinating communicator, and no clue is too insignificant when it comes to your health. Have you ever noticed a metallic aroma around yourself or a loved one that seems out of place? In some instances, a persistent metallic smell may suggest an issue with the blood, particularly in conditions like leukemia. Healthy blood maintains a stable balance of minerals, including iron, but when cancer disrupts production of blood cells, that balance changes. Leukemia, a malignancy affecting white blood cell formation, can skew internal chemistry and produce distinct scents. Researchers have linked these odors to the breakdown of proteins and abnormal shifts in iron metabolism. Some patients describe this smell as if they'd placed a few coins on their tongue or rubbed metal on their skin. Though this observation might seem subtle, it can serve as an early alert when combined with fatigue, frequent infections, or unexplained bruising. If you or someone close to you consistently notices a lingering metallic note, consult a medical professional without delay. Prompt diagnosis can make all the difference, as blood cancers often respond better when treatment begins early. Remember, it's crucial to pay attention to even the quietest signals. Sometimes they speak the loudest about your overall well-being. Breast cancer is one of the most commonly diagnosed forms of cancer worldwide, affecting millions of individuals each year. While routine screenings like mammograms detect many cases, certain subtle signs might offer even earlier hints. One surprising indication is a persistent sweet or slightly fruity smell emanating from the breast area or from ulcers that form on the skin. This odor often develops when the tumor modifies surrounding tissue metabolism, releasing unique compounds not found in healthy cells. Contrary to typical body odors that come and go with exercise or changes in diet, this unusual scent tends to linger. Researchers note that these metabolic byproducts, including volatile ketones and other organic molecules, might be behind the sweet aroma. It's a red flag, particularly if you experience other symptoms, such as a newly discovered lump, skin dimpling, or unexplained breast pain. Early detection is essential, as breast cancer is far more manageable when caught during its initial stages. Always consult a healthcare provider if you notice this lasting scent paired with any unexplained changes in your breast tissue. Being proactive with self-exams and medical checkups truly amplifies your power to defend your long-term health. The mouth and throat are gateways to your entire digestive system. Yet problems here often go unnoticed until they become severe. Oral and throat cancers can sometimes reveal themselves through a persistent musty, mold-like odor that even good oral hygiene won't mask. Scientists link this phenomenon to the way cancerous cells in the mouth, tongue, or throat break down and release distinctive chemicals. Add to that the possibility of secondary infections that might flourish on damaged tissues, generating even more pungent scents. In these cases, the odor may intensify when talking, exhaling, or if sores inside the mouth bleed or remain unhealed. Look for other signs such as stubborn ulcers, a scratchy throat, or changes in your voice that refuse to go away. If a musty odor continues for weeks without improvement, despite using quality mouthwash or improving dental care, it's wise to seek a specialist. Early evaluation can involve imaging scans or a biopsy of suspicious areas, giving doctors a chance to act before the disease progresses. By heeding this musty note, you prioritize your personal health and help protect your ability to speak, swallow, and live life to its fullest. Skin cancer, including melanoma, can be deceptively quiet in its early stages, often going unnoticed until it's advanced. Although visual cues like an evolving mole or changing pigmentation are better known, Certain forms of skin cancer also emit a decaying or rotting smell. Necrotic tissue on the skin's surface, caused by rapidly multiplying cancer cells, can produce strong odors that resemble spoiled meat. Such an odor may intensify if the affected area ulcerates or becomes infected, adding another layer of foul smell to the lesion. If an unusual odor persists despite proper skincare routines, or if a wound won't heal and keeps oozing, you should act promptly. Melanoma in particular can spread quickly, so ignoring an unpleasant scent might allow dangerous cells to proliferate even further. Dermatologists often rely on biopsies, dermatoscopic imaging, and thorough physical exams to pinpoint the exact nature of suspicious spots. By focusing on both visual and olfactory signs, you amplify your chances of catching skin cancer while it's more treatable. Never underestimate the significance of your sense of smell when it comes to changes in your skin. If something smells decayed or off, it's your body's way of prompting you to get checked immediately. Kidneys serve as your body's filters, removing waste products and balancing fluids to keep you functioning optimally. When tumors develop in these essential organs, it may interfere with normal filtration and cause unusual chemical byproducts to linger. One consequence is a strong ammonia-like smell in your urine or even in your sweat, particularly after mild physical exertion. Healthy kidneys convert excess nitrogen into urea, but compromised kidneys may fail in this detox process, leading to a potent odor. Anyone who experiences chronic flank pain, swelling in the legs or ankles, or unexplained fatigue alongside persistent ammonia smells should investigate further. According to recent medical studies, early detection of kidney cancer through imaging and laboratory analyses substantially boosts long-term survival rates. Unfortunately, the often silent nature of kidney tumors lets them progress if individuals disregard or overlook such clues. If you notice a pungent, ammonia overtones in your personal environment, see a doctor who can run kidney function tests and imaging scans. Listening to your body's chemical signatures might provide the crucial tip-off you need to protect your overall health. Remember, timely action against subtle signals is the cornerstone of preventive and proactive healthcare. Lung cancer is notoriously silent, sometimes revealing itself only when it has grown or spread. But emerging studies suggest that changes in breath odor, often described as sour, fermented, or faintly sweet, can be an early indicator. These odors arise from volatile organic compounds, VOCs, released by malignant cells in the lung tissue. Dogs trained in cancer detection have shown remarkable success in identifying individuals with lung tumors through scent alone. Scientists are now developing electronic noses designed to mimic the sensitive smell receptors in dogs to test patient breath samples for specific markers. If you regularly notice an odd, fermented odor when you exhale, especially if you're also dealing with chronic coughing, shortness of breath, or chest pain, don't ignore it. While these signs do not guarantee a cancer diagnosis, they certainly warrant further investigation by a pulmonary specialist. Screenings like low-dose CT scans or specialized breath analyses can detect lesions early, boosting the odds of successful intervention. In a world where many are unaware of the silent progression of lung disease, your sense of smell may provide a surprising defense mechanism. Stay alert to sour or fermented breath, and consult with healthcare providers to ensure your respiratory system stays in top shape. Unlike lung or breast cancer, colorectal cancer often develops from small growths in the colon or rectum that evolve over time. In some individuals, an intense smell resembling decomposition or raw sewage from the stool can herald deeper troubles. Tumors can disrupt digestion and the natural bacterial environment in the gut, causing toxic compounds to form and linger. If your stool carries an overwhelmingly foul, persistent stench that deviates from the normal variance in bowel odors, consider seeking examination. Additional symptoms like sudden changes in bowel habits, visible blood in the toilet, or ongoing abdominal pain further reinforce the need for urgent testing. Regular screening via colonoscopy or at-home fecal immunochemical tests can identify precancerous polyps before they morph into tumors. Healthcare professionals emphasize that consistent checkups and awareness of gut health make colorectal cancer one of the most preventable forms of the disease. Identifying these intense smells early and connecting them to potential gut issues can be a literal lifesaver in the long run. Never dismiss unusual digestive odors. Your sense of smell might be flagging an imbalance that needs prompt attention. Awareness, combined with specialized screening, remains your strongest strategy to maintain a robust digestive system. Our bodies communicate with us every day, sometimes with signals too quiet or too strange for us to believe at first. These distinct odors, whether metallic, sulfurous, sweet, or musty, could be nature's warning that a cancer might be lurking. Instead of ignoring these cues, consider them a timely push to consult medical experts for thorough evaluations. Stay informed and share these insights so others can also learn the importance of subtle symptoms and scents. If you found value in this discussion, we'd invite you to comment below with any experiences or questions you might have. You can also support this mission by liking the video and hitting that subscribe button for more content on health and well-being. Keep listening to your body, stay proactive about your screenings, and encourage others to do the same. Remember, small changes can signal big issues, and acting quickly can be the line between a positive outcome and a missed opportunity. Your health is your most precious resource, so stay alert, stay empowered, and let's continue building a community of awareness together.